Welcome everybody. I wanted to bring everybody together in a video today and talk about setting up your massage studio or your massage office or spa for coronavirus precautions. The biggest issue right now is creating a safe space. And by doing this, we want to make sure that we're keeping ourselves, our therapist, and our clients as safe as possible and limiting the exposure to coronavirus. We've come a long way from the beginning of this pandemic, and what I want to do is give you some tips and guidance on how to set up this massage therapy practice. Now, what you're going to see today is going to be the minimal essentials that we need to make sure that anything is not passed from the therapist or client or from client to client between sessions. Some of the biggest precautions right now is making sure that water droplets do not pass from one person to another. That is how we know it is the most contagious. So that is actually the most preventative measure, is to make sure that this is possible. We do this by adjusting the face cradle cover, wearing a mask, wiping down things that people touch, making sure people wash their hands or sanitize their hands when they walk in. So take some notes. If you have any questions, please leave any comments. And as always, make sure that you stay up to date with your CDC and local and state boards on precautions that you should be taking for your practice. What I want to start with today is a list of things that we need for setting up our massage therapy room. So please take note. One of the most important things is that we are preventative medicine, and so we should be preventing the spread of COVID-19 during our sessions. So a couple things that can help with that include a touchless thermometer so that you can check the temperature of each client before they walk into your office or studio. Next, you want to make sure that you have things such as hand sanitizer and disinfectant wipes available not only to you or your employees, but also to your clients. And essential oils are known for their antibacterial and antiviral properties. Two of my favorite essential oils to use are tea tree and bergamot oils. These two have some of the highest antiviral properties known in the essential oils. You also want to think about buying an air purifier to run in each of the massage rooms that you have and the general sitting area. Air purifiers with UV disinfectants are the best kind to make sure that any kind of airborne virus and bacteria can be caught and killed.
Wearing a mask is the number one safety protocol you can follow, either it being a normal surgical mask or even a DIY made at home cloth mask.
A few things to think about in preparation for seeing a client. Now, to prepare for your session, you want to make sure that the room is completely clean. You may want to make sure that you have a little bit longer time in between each of your clients and arrive early for your first client of the day. This allows you to disinfect using appropriate cleaners and allowing time for the cleaners to work. Your sitting and waiting areas should be changed around. Normally, sitting areas include multiple seats close by each other. To have the appropriate physical distancing, you want to make sure your seats are 6 feet apart. You may also want to exchange your cloth chairs for hard or easily cleanable chairs. You want to have washable, disposable lotion and cream holders. But if you use massage oil and a pump, just make sure that you disinfect it with disinfecting wipes after and before each client. You may also want to have a plastic container for your clients to put all their belongings in when they get into the room. The least amount of surfaces they touch or disturb, the less cleaning you'll have to do and the more safe the client is going to be. Suggestions for the bathroom includes touchless soap dispensers, paper towels instead of hand towels. Also have wipes available in your bathroom in case your client wants to wipe any extra surfaces down they feel may not be safe. There are areas of your space that you want to make sure that you clean before and after each client. These are all areas that you or your client will touch during the session or their visit. These areas include doorknobs, light switches, bathroom utilities like the sink faucet or the flush on the toilet. One goal in preventing exposure to coronavirus is preventing your clients and visitors to your office space from touching as many things as possible. So, meeting them at the door, opening the doors for them, and making sure that light switches are on for them in each room is a perfect way of reducing that exposure level. So one thing to think about is your bolster choice. There's two types of bolsters that you can use that you see most often. That is the pillow bolster, and then the kind of bolster that normally comes with the table. This is going to be the easiest type of bolster to use and clean. But as you can tell, the one that came with this table, not really that wide. It's not going to stand up to the comfort zone as maybe my king size pillow. So depending on the type of massage therapy that you do will depend on what you need. One of my most important factors in doing a session is relaxation and comfortability on the table. So I'm going to use the king size pillow, but the king size pillow is obviously made of cloth, so you need to make sure that it is safe from exposure to coronavirus. By doing that, you're simply going to take the pillow and you're going to put it in the bottom of all the layers underneath your mattress cover, any extra cushioning that you have, and of course the layers of sheets that you have on the table as well. With this kind of bolster, you can place it wherever you like. You can just put a pillowcase over it or none at all, but you can also put this underneath all the layers as well, and it will stay just as safe, and you can still clean it in between every session, and that is a very good option. You may also want to have a mattress cover to cover any of the extra cushioning on top of your table. This cover can be easily washable or used with disinfectant wipes. So when it comes to the face cradle, the biggest objective is simply just to keep water droplets from entering the atmosphere. By doing this, the easiest step is just to ask your client to wear a mask the entire time. Now they'll be bringing a mask in anyways, so that shouldn't be a problem. They should all have that accessible, or you can have some disposable ones ready at your office. But if you want them to be a little bit more comfortable, this technique might be a help. It allows for them not to have to wear the mask while they're on the table, and it is a little bit more comfortable because they're not breathing hot breath during a relaxing massage. So I'm going to take this off just to show that I have nothing over the base layer of the face cradle, and this is because I want to make sure I can clean it in between each session very well. So I'll just take a disinfectant wipe and clean this fabric that is very easily cleaned, and then I'll let it sit and then add the dressing again. So my normal cover is just a fitted face cradle cover. So we're going to put that on, and you dress your cradle however you normally do. The second layer is the most important part. The second layer is a regular standard pillowcase, and you're going to line it up lengthwise, the top of it where the forehead goes, and you're simply going to tuck this down into the hole of the face cradle. And the bottom of it is just spread out across the bar that's always right here. This creates a nice breathing area, and it kind of lets them be a little bit more relaxed. They're not breathing in the hot air of their breath, and they can stay face down more comfortably longer periods. Now, one of the draping techniques that I use when I use this face cradle cover is to make sure that the top sheet comes pretty much over the face cradle. That way, when they turn over, you simply lift this up. You're standing behind the sheet, and they can turn over and scoot down without there being much of exposure to accidental coughing or sneezing. Once they have turned over, you can go about your normal business, but you're just going to grab the pillowcase by two ends, and you can do a little tri-fold and simply place the pillowcase back over their nose and mouth, and maybe even tuck it underneath their head so that it stays there without falling down and is a little bit more comfortable. What I've noticed is that clients tend to be a little bit more subconscious about the pillowcase falling down, so you can also ask them just to put on their mask as well. And putting on their mask is actually great if you're doing really in-depth neck work, because you don't have to worry about the pillowcase being in the way or having to shift it back and forth. So there's nothing wrong with having the client put their mask back on before they turn over, and then you're free to do your normal massage therapy techniques. Now, one question I get a lot is if I switch out the blankets on top. Yes, the blankets on top should be switched out during sessions, because unless you are meticulous about moving the blanket with the sheet below and not touching it, it is going to be most likely that you're going to put oily hands that have been all over the person's body onto the sheet and the blanket, and you can't get away from it. So my suggestion, what I did, I have a bunch of throw blankets that I use instead of the big fluffy blankets that are very warm. And I also bought a pack of yoga blankets, and these are, as you can tell, some come with tassels and some options come without. And they're thin, they're easily washable, and I just crank up the table warmer for my clients who tend to be cold. But right now it's summer, so most people don't even have an issue with it. And when I break down the table, I simply throw everything in the center, just like that. And it all gets folded up on itself. So you end up having one nice little package that you could throw directly into the laundry or into your laundry basket and wait to the end of the day to do your laundry. Keeping you, your staff, and your clients safe is the best way for preventative care and to helping the community. This is good not only for preventing exposure to coronavirus, but also for being a healthy role model in your community. When clients know that you are safe and you're taking the precautions, the word will spread and people are more likely to come in for their normal services.